152 and 11-CDASB for serotonin transporters, 1,8-F-MEF-Way for serotonin 5-HT1A receptors, 1,8-F-Nefin for nicotinic acetylcholine receptors or enzyme substrates, e.g. 6-FDOPA for the AADC enzyme. These agents permit the visualization of neuroreceptor pools in the context of a plurality of neuropsychiatric and neurologic illnesses. The development of a number of novel probes for non-invasive, in vivo PET imaging of neuroaggregate in human brain has brought amyloid imaging to the doorstep of clinical use. The earliest amyloid imaging probes included 2,1,6,2,18-F-fluoroethyl, methyl, amino 2-naphthyl-ethylidene, malononitrile, 1,8-FFDDNP, 15 developed at the University of California, Los Angeles, and N-methyl-11C2, 4-methylaminophenyl, 6-hydroxybenzothiazole 16, termed Pittsburgh Compound B, developed at the University of Pittsburgh. These amyloid imaging probes permit the visualization of amyloid plaques in the brains of Alzheimer's patients and could assist clinicians in making a positive clinical diagnosis of AD premortem and aid in the development of novel anti-amyloid therapies. 11-CPMP, and 11-C-methylpiperidine 4-YL-propionate, is a novel radiopharmaceutical used in PET imaging to determine the activity of the acetylcholinergic neurotransmitter system by acting as a substrate for acetylcholinesterase. Post-mortem examination of AD patients have shown decreased levels of acetylcholinesterase. 11-CPMP is used to map the acetylcholinesterase activity in the brain, which could allow for pre-mortem diagnoses of AD and help to monitor AD treatments. 17 Avid Radiopharmaceuticals has developed and commercialized a compound called fluorbatapar that uses the longer-lasting radionuclide fluorine 18 to detect amyloid plaques using PET scans. 18. Neuropsychology/cognitive neuroscience, to examine links between specific psychological processes or disorders and brain activity. Psychiatry, numerous compounds that bind selectively to neuroreceptors of interest in biological psychiatry have been radiolabeled with C11 or F18. Radioligands that bind to dopamine receptors, D119-D2 receptor 2021 reuptake transporter, serotonin receptors, 5-HT1A, 5-HT2A, reuptake transporter, opioid receptors, mu and kappa, cholinergic receptors, nicotinic and muscarinic, and other sites have been used successfully in studies with human subjects. Studies have been performed examining the state of these receptors in patients compared to healthy controls in schizophrenia, substance abuse, mood disorders and other psychiatric conditions. Stereotactic surgery and radiosurgery, PET image-guided surgery facilitates treatment of intracranial tumors, arteriovenous malformations, and other surgically treatable conditions. 22. Cardiology. Main article, Cardiac PET. Cardiology, atherosclerosis, and vascular disease study, 1,8-FFDG PET can help in identifying hibernating myocardium. However, the cost-effectiveness of PET for this role versus SPECT is unclear. 1,8-FFDG PET imaging of atherosclerosis to detect patients at risk of stroke is also feasible. Also, it can help test the efficacy of novel anti-atherosclerosis therapies. 23. Infectious diseases. Imaging infections with molecular imaging technologies can improve diagnosis and treatment follow-up. Clinically, PET has been widely used to image bacterial infections using fluorodeoxyglucose, FDG, to identify the infection-associated inflammatory response. 3 different PET contrast agents have been developed to image bacterial infections in vivo are 1,8-F maltose 24, 1,8-F malta hecaose, and 1,8-F2 fluorodeoxysorbitol, FDS. 25 FDS has the added benefit of being able to target only Enterobacteriaceae. Biodistribution studies. In preclinical trials, a new drug can be radiolabeled and injected into animals. Such scans are referred to as biodistribution studies. The information regarding drug uptake, retention, and elimination over time can be obtained quickly and cost-effectively compared to the older technique of killing and dissecting the animals. Commonly, Drug occupancy at a purported site of action can be inferred indirectly by competition studies between unlabeled drug and radio-labeled compounds known a priori to bind with specificity to the site. A single radioligand can be used this way to test many potential drug candidates for the same target. A related technique involves scanning with radioligands that compete with an endogenous, naturally occurring, substance at a given receptor to demonstrate that a drug causes the release of the natural substance. 26. Small animal imaging. A miniature PE tomograph has been constructed that is small enough for a fully conscious and mobile rat to wear on its head while walking around. 27. This rat conscious animal PET, allows animals to be scanned without the confounding effects of anesthesia. PET scanners designed specifically for imaging rodents, often referred to as micro-PET, as well as scanners for small primates, are marketed for academic and pharmaceutical research. The scanners are based on microminiature scintillators and amplified avalanche photodiodes, APDs, through a system that uses single-chip silicon photomultipliers. Citation needed. In 2018, the UC Davis School of Veterinary Medicine became the first veterinary center to employ a small clinical PET scanner as a PET scan for clinical, rather than research, animal diagnosis. Because of cost as well as the marginal utility of detecting cancer metastases in companion animals, the primary use of this modality, veterinary PET scanning, is expected to be rarely available in the immediate future. Citation needed. Musculoskeletal imaging. PET imaging has been used for imaging muscles and bones. 18FFDG is the most commonly used tracer for imaging muscles, and 18FNAF is the most widely used tracer for imaging bones. Muscles. PET is a feasible technique for studying skeletal muscles during exercises like walking. 28. Also, PET can provide muscle activation data about deep-lying muscles, such as the vastus intermedialis and the gluteus minimus, compared to techniques like electromyography, which can be used only on superficial muscles directly under the skin. However, a disadvantage is that PET provides no timing information about muscle activation because it has to be measured after the exercise is completed. This is due to the time it takes for FDG to accumulate in the activated muscles. Bones. Together with 18FNAF, PET for bone imaging has been in use for 60 years for measuring regional bone metabolism and blood flow using static and dynamic scans. Researchers have recently started using 18FNAF to study bone metastasis. 29 as well. Safety. PET scanning is non-invasive, but it does involve exposure to ionizing radiation too. 18FFDG, which is now the standard radiotracer used for PET neuroimaging and cancer patient management. 30 has an effective radiation dose of 14 msv3. The amount of radiation in 18FFDG is similar to the effective dose of spending 1 year in the American city of Denver, Colorado, 12.4 msv/year. 31 For comparison, radiation dosage for other medical procedures range from 0.02 msv for a chest X-ray and 6.588 msv for a CT scan of the chest. 32-33 Average civil aircrews are exposed to 3 msv/year. 34 And the whole body occupational dose limit for nuclear energy workers in the USA is 50 msv/year. 35 For scale, see orders of magnitude. Radiation. For PET CT scanning, the radiation exposure may be substantial at around 23826 msv, for a 70 kg persona dose is likely to be higher for higher body weights. 36-37. Operation. Radionuclides and radiotracers. Main articles, list of PET radiotracers and fluodeoxyglucose. Schematic view of a detector block and ring of a PET scanner. Radionuclides used in PET scanning are typically isotopes with short half-lives too, such as carbon 11, 20 min, nitrogen 13, 10 min, oxygen 15, 2 min, fluorine 18, 110 min, gallium 68, 67 min, zirconium 89, 78.41 hours, 38 or rubidium 82, 1.27 min. These radionuclides are incorporated either into compounds normally used by the body such as glucose, or glucose analogues, water or ammonia, or into molecules that bind to receptors or other sites of drug action. Such labeled compounds are known as radiotracers. PET technology can be used to trace the biologic pathway of any compound in living humans, and many other species as well, provided it can be radio-labeled with a PET isotope, 152 and 11-CDASB for serotonin transporters, 18F-MEF-WAY for serotonin 5-HT1A receptors, 18F-NAFIN for nicotinic acetylcholine receptors or enzyme substrates, e.g. 6-FTOPA for the AADC enzyme. These agents permit the visualization of neuroreceptor pools in the context of a plurality of neuropsychiatric and neurologic illnesses. The development of a number of novel probes for non-invasive, in vivo PET imaging of neuroaggregate in human brain has brought amyloid imaging to the doorstep of clinical use. The earliest amyloid imaging probes included 2,16,218F fluoroethyl, methyl,